success the world over is based on good health and education. However, the incidence of breast cancer is rising in every country of the world, especially in developing countries such as India. This is because more and more women in India are beginning to work outside their homes, which allows the various risk factors of breast cancer to come into play. The Basavatarakam Indo Cancer Hospital and Research Institute uses the most technologically advanced equipment to customize a multimodality treatment for breast cancer patients. Survival rates among breast cancer patients are climbing thanks to greater awareness, more early detection, and advances in treatment.
What would be of great relevance in breast cancer is the rapid strides and advances that we have made in this direction. Basically, in terms of screening, mammography resolutions have improved so much that even at a level wherein you cannot feel or see a tumor, you can diagnose this on digital mammography. And then if you diagnose by mammography, you have a very high chance of cure for these patients with simple treatment without actually sacrificing the breast. The scare that the people and the patients have is the loss of breast. Loss of breast is like losing a limb for a lady. So that can be avoided if you are breast aware. Be aware of your breast. Anybody with a breast can develop breast cancer. So do not be really scared of developing the disease, because many times you don't have a choice. What you can choose is good diagnosis, early diagnosis, and good treatment.
The earlier breast cancer is found, the easier it is to treat. So, it's important to have anything unusual checked by your doctor. The tests used for screening and diagnosis include mammogram, ultrasound, biopsy, MRI, and more. The size, stage, rate of growth, and other characteristics of the tumor determine the kinds of treatment. Treatment may include surgery, chemotherapy, radiation, and hormone therapy. Surgery offers the greatest chance for cure for many types of cancer. Chemotherapy uses drugs to kill cancer cells anywhere in the body. The drugs are often given by IV, but are sometimes taken by mouth. Chemotherapy may be done after surgery to lower the odds of the cancer coming back. Radiation therapy uses high-energy rays to kill cancer cells. It may be used after breast cancer surgery to wipe out any cancer cells that remain.
The latest technique of radiation is IMRT, IGRT, and intraoperative radiation therapy. The idea of IMRT, intensity modulated radiation therapy, is that the radiation is given only to the tumor site and the normal tissues are protected from the radiation. There are a lot of recent advances in the radiotherapy patterns so that to protect the normal tissue and just give the radiation only to the tumor and this. And there is also, we got an image guided radiation therapy, especially when the breast lump is removed. The breast keeps moving with the respiration. To keep the breast and the tumor in the field of radiation, we give image guided radiation therapy. And the most latest is intraoperative radiation therapy, and this is very useful, especially when the tumor is diagnosed in an early stage, less than 3 centimeters. And if the tumor has not spread to the nodes, we give intraoperative radiation therapy. And after the surgery, the radiation is given in the theatre. Only 1 dose of radiation is given, and it is 3 times the dose of the external radiation. So that is the advantage of early diagnosis.
Hormone therapy is an effective treatment for women with ER positive or PR positive breast cancer. These are cancers that grow more rapidly in response to the hormones estrogen or progesterone. Hormone therapy can block this effect. It is most often used after breast cancer surgery to help keep the cancer cancer from coming back.
The simple message to everybody is, instead of being afraid and running away from this problem called as breast cancer, it's important to seek medical help as soon as there is some suspicion that you may be having this problem. Seek medical help, do the necessary investigations, listen to the doctor and undergo surgery, chemotherapy, radiotherapy, plus or minus the other treatments as and when necessary. Take the help of the allied staff to help you through all these treatments easily and come out victorious of this disease, because the only way to win is to muster courage in fights and not run away.
However, exercising regularly can lower breast cancer risk by about 60% in adults.
Breast cancer is most prevailing disease in ladies nowadays. This is because of faulty lifestyle habits, that is irregular dietary habits, lack of exercise and lack of consciousness. All these factors are prevailing for all these diseases. Prevention is better than cure. Once if you change your lifestyle habits, you can prevent all these diseases. If you follow the certain natural habits like following the regular exercise, by following the diet, especially high fiber diet, taking more of vegetables and fruits in the diet, and low fatty diets will prevent most of the reoccurrences in breast cancer. And doing the yoga relaxation techniques plays a major role in preventing the reoccurrences as well preventing the breast cancers, because that gives psychological factors, and stress factor is also one of the most common cause for getting the breast cancers. So to prevent that, if you can practice regular yoga and meditation, relaxation techniques every day, that helps a lot to reduce the incidence of breast cancer.
Let me see it as a success story. But at the Basavatarakam Indo Cancer Hospital and Research Institute, awareness on breast cancer and a multimodality treatment for breast cancer patients has brought happiness to millions of families.